Good day, fellow learners. Once again, this is your mentor, your fact check buddy, Ray Gapuz, joining you for another learning and teaching session. This time around, we're going to talk about our next generation NCLEX RN pointers, set number 42. And just like how we always do it, we will do it using your functional concepts method. Remember our mantra, our functional concept a day keeps your NCLEX RN fears away. Okay, so before we get to start, I'd like to ask you to join us in this mission. We've done it last year. In the past 2 years, actually, our goal is to provide free NCLEX RN application and review to 100 nurses from Luzon, Visayas, and Mindanao here in the Philippines. And to help us achieve this, just watch and finish the ads in our videos. You don't have to send us anything. Just don't skip the videos. And you may definitely share our videos to your friends. If you want to help them out, go ahead and share our videos in this channel. Okay, so let's begin with pointers set number 42. So the first question that we should ask ourselves is, when we're preparing for the next generation NCLEX, what do we need to study? Of course, as a learner, we can't do that alone on our own. We need an expert opinion. And when you say expert, real experts, people who just did not pass the test and then taught right away, but people who have immersed themselves into the test framework of the NCLEX RN. And that's who we are at the Ray A. Gapuz review system. We have been in this business since 1994, and we have produced hundreds and thousands of nurses worldwide, most of them with very inspiring stories. Okay, so let's begin with our first set of pointer, and that's going to be related to cataract. So we'll talk about cataract, and for this specific condition, always remember, pay particular attention to syndrome, meaning a group of symptoms that potentially describes the presence of cataract, like the gradual loss of central vision or opacity of the crystalline lens. It is painless. Some clients would describe it as blurry vision. Some would even complain of double vision. And some would complain about sensitivity to glare and frequent changes in their eyeglasses. Okay, now what are the things that we have to remember? First and foremost, cataract is related to aging, and the treatment would usually involve surgery, like surgical removal of the cataract, and that would entail the administration of drugs, like preoperative medications that could help dilate the pupils to prepare the area for surgery. And the example of these drugs could be phenylephrine, okay, atropine sulfate, and of course, your homeotropine. Now, these drugs can dilate the pupils, will dilate the pupils, and these drugs are indicated preoperatively for a patient with cataract, but not for patients with glaucoma, as this could potentially increase the intraocular pressure. Okay, now, after surgery, what should be the focus of your discharge instruction? First and foremost, among those instructions that you will provide the client should be on keeping the area safe from unconsciously scratching it. So we have to tell the client to wear eye shield, okay, for the area that has been subjected to surgery. And then after that, we need to instruct the client to avoid certain activities which may potentially lead to complications, like, for example, bending or coughing or lifting or any activity that may increase intraocular pressure. Now, it's not actually directly contraindicated for the client to read, but reading or moving the eyes within 24 to 48 hours after an eye surgery is not comfortable. So it's uncomfortable. So better yet, we need to tell the client to avoid these things. And whenever a patient has undergone eye surgery, it's very important to include in the discharge instructions certain complications, specifically those that would require immediate intervention from the nurse, like bleeding. Now, how can this be manifested through a group of symptoms? So remember, think syndromic. So report any sign of severe eye pain after cataract surgery, because this indicates that the client could be having hemorrhage or bleeding, or the presence of visual floaters, like the patient would say, I see cobwebs in front of my eyes, I see veil-like structures in front of my eyes. This could potentially indicate retinal detachment. And of course, intraocular pressure could also be increased after surgery. So report if the patient experiences pain, nausea, as well as vomiting. And of course, whenever there's a discharge that could be greenish or yellowish, then you also need to report this, as this could potentially indicate that the client could have developed infection. Okay, so those are the things that you need to highlight when your patient is being given discharge instructions post cataract surgery. Now, before we proceed any further, I'd like to congratulate Ronabel Pinzon Cristobal from the Pangasinan State University, that's in the northern part of the Philippines, who passed the New York Board of Nursing Next Generation NCLEX RN last March 7, 2024. And let's learn from her success recipe. So after 4 years of my nursing course, I passed the nursing licensure exam in the year 2014 with the help of our Lord and also the Ray Gapuz review system. For nurses, I thought this is enough to excel in my chosen profession. But when I heard of the NCLEX examination, I decided to apply and take said exam. My application to take said exam was approved. To fulfill my ambition to have a better job, I decided to enroll again in RAGRS for a review. With this decision, I started again a new journey or chapter of my life. In this journey, I spent sleepless nights studying and reviewing what our loving and patient mentors are teaching us. And I firmly believe that through God's grace, I can overcome all the trials and I will have the victory. On March 7, 2024, I had my examination for NCLEX RN. I had sleepless nights. I prayed wholeheartedly that I will pass. I completely gave my trust unto Him. During my examination, I said, wow, thank you, Lord. Lahat ng tinuro ng mga mentor specialist survey na pag-aralan namin. So what she's saying is, everything that the mentors taught, especially Sir Ray, were in the test. And I consumed my time properly. And this is it. My laurels is in my hands. I passed the examination. I'm speechless, but in my heart, I thank God for these blessings. Thank you, Sir Ray, to all the mentors and staff in RAGRS who patiently taught and helped me to complete my journey. Thank you also to ICAPS Gapuz who patiently processed my NCLEX application, especially to Ma'am Diana and Ma'am Faith. Thank you also to my beloved parents, family, and loved ones, friends, and especially to my grand Lola, who always supports me in everything I do. And lastly, as God said, in everything you do, put God first and He will direct you and crown your efforts with success. Proverbs 3, verses 6. Ronabel Pinzon Cristobal, USRN. Congratulations, Ronabel. And before we proceed any further, I'd like to make this clarificatory advisory. Dr. Ray Gapuz, that's me, your mentor, and the rest of the mentors of the Ray Gapuz system are not, let me repeat that, are not part of another center named Gapuz Review. So you always have to look for the Ray A. Gapuz Review system, not any other things that could be similar to what our company name is. Okay? So the next thing that we'll focus on will be the concepts related to glaucoma. Now remember, glaucoma is due to increased intraocular pressure. And to differentiate it from cataract, the main problem rests on the crystalline lens that have turned opaque. In glaucoma, there's damage to the optic nerve, okay? And it's often due to increased intraocular pressure. Now, pay particular attention to the fact that glaucoma has a genetic basis. So, how would you know that a client could be having glaucoma? Well, the patient could initially complain about tunnel vision or gun barrel vision, or they would describe it as they feel as if their vision is closing in from both sides and everything on the sides could be dark and the central area could just be the ones where they get to see something. So this creates a tunnel effect when they try to see things. Now, other symptoms of glaucoma Could include halos around lights, okay, dim vision, frequent changes in eyeglasses, just like a client with cataract, and of course, dim vision. And sometimes you could have blind spots. And of course, the characteristic or most outstanding sign that differentiates it from cataract is the loss of peripheral vision. That's what we're describing a while back, that it's being described by clients as gun barrel or tunnel-like vision. So if it's cataract, usually it's a central vision that becomes blurry. If it's glaucoma, it's the peripheral vision that could be affected. And of course, the patient could also have severe headache, eye pain, and vomiting. Okay? Now, let's compare again the treatment for a client with cataract and for a client with glaucoma. For a client with cataract, we prepare the client for surgery, and so therefore we give them mydriatics, drugs that dilates the pupils. For clients with glaucoma, we give the client medications that constricts the pupil, like pilocarpine, and that's your miotic. We also give clients with glaucoma beta blockers or carbonic anhydrase inhibitors. Example of beta blockers would be timolol, maleate. Example of carbonic anhydrase inhibitors would be acetazolamide. Now, our beta blockers and carbonic anhydrase inhibitors would help decrease the production of aqueous humor, thereby decreasing the intraocular pressure. Now, some other drugs that could be given to the clients could be your prostaglandin agonists like lantaprost, and this is given to increase the reabsorption of aqueous humor, further decreasing the intraocular pressure. Now, mydriatics should never be given to clients with glaucoma. Why? Because these drugs could potentially increase the intraocular pressure. Okay? And when glaucoma persists, eventually it could lead to blindness. So it's very important that regular eye checkup and a visit to the ophthalmologist. Remember, an ophthalmologist is a doctor of medicine who specializes in eye diseases, and they can perform surgery. We differentiate them from optometrists. Optometrists are doctors of optometry who are specialized in assessing the eyes and prescribing the lenses. They can also treat eye disorders, but they cannot perform eye surgery to the extent that your ophthalmologist can do it. So which simply means that if the patient would need a revision of the eyeglasses, then refer them to an optometrist. But if they need further assessment for the possibility of having glaucoma or other eye disorders that could be more serious and would need more intervention other than just wearing eyeglasses, then you need to refer the client to an ophthalmologist. So that's the difference between the ophthalmologist and the optometrist. Okay. Now, if you would note here in the picture that is being presented, the eye that has glaucoma is the one that is usually reddish. And if you would take a look at the central area, okay, the pupils would usually not react to light, especially if this is closed angle glaucoma, where the intraocular pressure is higher than in open angle or chronic glaucoma. Okay? Now, let me congratulate all those who pass under our system. We have hundreds of thousands of passers from all around the world who've been passing their next generation NCLEX through the Ray Gapuz system. Now, the third concept that I'd like to highlight at this point would be the concepts related to retinal detachment. So, when you hear a patient say, I'm having painless, blurry vision, and I think I've lost my central vision, then suspect cataract. But if the patient would say, I'm having tunnel-like or gun barrel vision, and the peripheral part of my visual field are all dark, then suspect glaucoma. But if a patient would tell you, I see floating spots in front of my eyes, I see veil-like structures in front of my eyes, I see web-like structures in front of my eyes, then you suspect retinal detachment. Okay, because floating spots in the visual field is characteristic of retinal detachment. Now, pay particular attention to the fact that the main problem in retinal detachment is the detachment of the pigmented retina from the sensory retina. So signs and symptoms could be the characteristic visual floaters, okay? Then loss of peripheral vision or the presence of a shadow-like or curtain-like um, thing on your visual field. Definitely, the intervention would involve several types of surgery, like pneumatic retinopexy, in which the surgeon injects a bubble of air to push the area of the retina containing the hole against the wall of the eye, thereby preventing further detachment. Or they could do scleral buckling, in which the surgeon would actually sew a piece of silicone to the sclera to indent the eye and push it back into its normal position. Or they could remove the vitreous tumor through a surgical intervention known as vitrectomy, okay? And then they replace that with air or gas or silicone, which will eventually flatten the retina. So all of these surgical interventions are meant to prevent further detachment of the retina. Now, the most important thing that you have to remember for your test is the fact that if a client has retinal detachment, remember to always position the client on the affected side to prevent further detachment. And there are certain things that you need to modify at home when the client gets discharged. Like, for example, instruct them to avoid any activity that may increase intraocular pressure, like bending or reading or coughing or doing the Valsalva's maneuver. And definitely, you'll have to instruct them to modify their home lighting. So instead of bright lights, they should use warm lights because there are studies actually that say that um, halogen or incandescent light could potentially harm the eyes if these are used for a prolonged period of time. So bulb that emits warm lights could be more preferred than those that emits very, very bright lights. Okay? So let's share with each other this conversation I had with another pastor recently. Her name, Elma Bauto. I asked her, which part of our review helped you the most? And this is what she has to say. All of it, sir. Then, she says in Filipino, ginawa ko po yung sinasabi nyo na a day before my exam, basahin ng 311. So, I did what you advised me that a day before my exam, I have to read 311. 311 is NCLEX 311, the book that I authored, and that's a local version of a book that's published by Johnson Bartlett USA under the title NCLEX RN in a Flash. And she says, dinala ko pa po dito sa Las Vegas ang books niyo sa akin. So, she said she brought my books from the Philippines to Las Vegas. And she further shares, inaabot po ako ng 4 a.m. pag may quick fix tayo. Worth it po lahat. She keeps awake until 4 a.m. whenever she attends my quick fix sessions. But according to her, it's all worth it. And I asked, is the quick fix helpful? She says, yes, very helpful ang quick fix. Kaya ba ipasa ang NCLEX na materials lang gamit? So I asked her if a person can pass the NGN by just using materials. And she says, definitely no. Napakalaking tulong po ng mga lectures natin. So she says, the lectures are a big help. Functional concepts, panalo po. So the functional concepts is a winner. Sir, maraming salamat po ulit. 2 RN board exam from you, both take one lang. So she's saying, thank you so much. I had 2 licensure exams, meaning one from the Philippines and the US, and she passed both with just 1 try. Maraming salamat sa tiwala sa system. So I told her, thank you very much for trusting our system. And she replied by saying, you are truly the best. Thank you for the kind words, Elma Bauto. Now, what are the things that you need to consider when you're preparing for the next generation NCLEX? Now, knowledge of concepts and facts should never be, I repeat, should never be the only preparation that you need to work on. You need to study using technology, because even if you know the facts, if you don't know how to navigate the exams, it's a big no-no. So here at the Gapuz system, we have a set of NCLEX tools like NCLEX RN in a Flash. That's a book published by Jones and Bartlett USA. Look, okay, it's being sold side by side, and it's once tagged as customer's favorite in Barnes and Nobles. Okay, and then we also have our core shells. Now, this is now on a promo. You just pay $29 and you can have a full access to this core shell. If you're not taking the test beyond the 60 days that you are given the access, you just let us know. We'll extend it until you pass. Okay, and of course, the third requirement for passing the NJN is for you to have a conducive learning environment. And here at the Ray Gapuz system, we have our own NCLEX simulation room where our learners practice in an almost real-life learning environment, or call it testing environment. And of course, our learning environment have always been very, very conducive. So may I invite you to avail of our next generation NCLEX RN Flex, the most flexible test preparation class for the NCLEX RN. You can have a choice of live face-to-face class. You have a boot camp. It's a 10-day boot camp, live virtual class, on-demand, unlimited video recorded lessons, if that's what you need. We also have our QBank for standard multiple choice, and of course, NGN items. We also give away for free 3 books, and of course, my NGN strategies plus my quick fix session. Remember, the quick fix session is a trademark of the Ray Gapuz system. Nobody's allowed to use that if they have not undergone the training under our system. And definitely, the functional concepts method is a unique innovation of Ray Gapuz. So, it's not found anywhere else except in our system. So that's not supposed to be delivered by those who don't know how to teach using functional concepts method. So our fee starts at $3,499, and we'd like to see you avail of this program. So once again, this is your mentor, your fact check buddy Ray Gapuz, saying thank you and see you in my next video.